Hello everyone, this is Dr. Sangeetha. I'm endocrinologist. I'm practicing at Tanishta's Diabetic Endocrine Center and Kidney Center at Nagul. What are the types of diabetes? There can be various types of diabetes. Broadly speaking, type 1 diabetes and type 2 diabetes. But again, type 2 diabetes is a diagnosis of exclusion. So you should look for the other causes of the diabetes also before labeling a patient as type 2 diabetes. So type 1 diabetes is because of basically the insulin deficiency, and roughly speaking or broadly speaking, it's usually the onset is in the young individuals and it presents with the severe insulin deficiency and severe hyperglycemia, that is very high blood sugars in the body. Type 2 diabetes is usually the one which we commonly see, and it is the genetically mediated, that is if the family history is positive or lifestyle disorder related. Other than this, the other diabetic related causes could be hormone issues. Any other hormones also, any abnormality of the hormones also can cause increased blood sugar levels. For that matter, example, increased steroid intake from outside also can cause diabetes, or if any steroid hormone is being produced in the excess in the body also can cause diabetes. Thyroid disorders, especially hyperthyroidism, can also cause diabetes or increased blood sugar levels. What we call as the hormonal causes of the diabetes, and the other causes could be increased growth hormone or very rare other hormonal disorders. Other than this, we have the pancreatic diabetes, that is for any reason if pancreas is being damaged, it's not working properly, if the gland wherein the insulin is being secreted is affected, also can cause diabetes. Other than this, you can have the young onset diabetes, that is maturity onset diabetes of the young. So this is again genetically mediated, but it is not exactly type 2. So if there is any suspicion, the patient should be subjected to genetic analysis. What is the effect of diabetes on various organ systems in the body? Diabetes should always be controlled. Otherwise, it has its deleterious effects on all the organ systems. Especially uncontrolled blood sugars affect each and every organ system in the body, be it eyes, be it kidney, be it heart, or be it the nerves. That is the reason strict control of diabetes is very important to avoid these complications. The complications of diabetes are acute complications and the chronic complications. So the effect of diabetes on these organ systems is what we call as the chronic complications. To avoid these chronic complications, definitely the diabetes proper management is recommended. So the main cause in the present scenario most common cause in the present scenario for the cardiac diseases or the kidney diseases is diabetes. So please take care of your diabetes. How do you diagnose diabetes? If a patient is asymptomatic, usually we ask the patient to go for the screening for diabetes based on the risk factors. So for the screening of diabetes, usually the test recommended is the glucose tolerance test. That is, the patient is asked to go to the lab in the fasting state, and after that the patient is submitting the fasting blood sample. Then the test is known as a 75 grams oral glucose tolerance test. That is, after giving the glucose, the patient is supposed to submit the blood sample again after 2 hours. This is for the non-pregnant individuals. For the pregnant individuals, usually the test which is done is the 75 grams oral glucose tolerance test in pregnancy. That is, after giving the blood sample, you take 75 grams of glucose, but you are going to submit the blood sample at 1 hour and 2 hours after the glucose ingestion. Mind you, in these 2 hours, you are not supposed to take anything else except the glucose water which is provided by the lab. This is the way you usually diagnose the diabetes. Other than this, the one more criteria which is really helpful in the diagnosis of diabetes is the HbA1c. This is the average blood sugar over the past 3 to 4 months. Just by one sample, you can just analyze what is the average blood sugar over the past 3 to 4 months. So coming to the criteria, if the fasting blood sugar is more than 126, or in a non-pregnant individual, if the post-glucose blood sugar is more than 200, then you can label the patient as diabetic. Similarly, a HbA1c value more than 6.5, you label the patient as diabetic. In pregnancy, the criteria will be different, but these are the common criteria which we use for the diagnosis of diabetes. But Along with this, if the patient is symptomatic, hyperglycemia, that is, as we have already discussed, that is loss of weight, increased thirst, hunger, or if the patient is having any tingling, numbness or blurred vision, random blood sugar of more than 200 also, usually it's suggestive of diabetes, but the best criteria is to go with the oral glucose tolerance test. What is the treatment of diabetes, or how are you going to treat diabetes? Treatment of diabetes depends on the severity, or for that matter, we usually take the fasting levels, post glucose and the HbA1c into consideration. So mild hyperglycemia, that is mildly elevated blood sugar levels, you can ask the patient to go for only lifestyle modifications, that is diet and exercise. But increased levels, accordingly, we start the patient on the single drug or multiple drug regimen. But nowadays, we usually recommend the patients to start off with the double drug regimen to have the proper control, because we have much better tablets which can control the sugars without, or we can avoid most of the side effects of the tablets. So the criteria is HbA1c should be less than 6.5 after starting the treatment. This is a criteria we try to satisfy so that we can say the patient is having the good diabetic control. Either your patient can go for the oral tablets, that is the tablets which can be taken through the mouth, or sometimes injectables are also available. So for the various treatment options and the preferences and what your doctor will choose based on the patient, you have to consult your doctor regularly and do the treatment adjustments accordingly. When do you call as a diabetes controlled or uncontrolled? After starting the treatment, usually the patient is being regularly followed up with the fasting blood sugars and the postprandial blood sugars, and as per the requirement, HbA1c. The recommended HbA1c is once in 3 months. So the criteria to say the patient is having control is fasting should be less than 130, and postprandial, that is after food, what we check the sugar should be less than 180, and HbA1c should be less than 6.5. This is a criteria which has been accepted widely, even the ADA recommends, but again, based on the patient, it's a tailored treatment. It doesn't mean that these are applicable to everybody. So based on the comorbidities, that let's say if the patient is having any kidney disorder, any other heart disorder, very elderly patients, so we take all these criteria into consideration, and accordingly the doctor decides whether the control is good or whether you should have strict control, or whether the control can be slightly liberalized. Especially in the young individuals, the criteria is applicable and we try to have very strict control. As the age advances, or if the patient is having any other comorbidities, based on the patient and the disease severity, the doctor decides the control. Awareness is the first step for good health. Please take care. Have a good day.